Hi, we will be talking about the concept of holistic care that includes the physical, psychological, social as well as spiritual. The lecture has been prepared by Dr. Arun Dekar. He is Secretary of National Association of Palliative Care for Ayush and Integrative Medicine, Assam chapter. Health, according to World Health Organization, is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Holistic health presumes to enlarge the traditional sphere of medical allopathic concern from a narrow, largely technical focused on symptomatology and disease to broaden the domain, including psychological aspects, spiritual concern, social well-being and proper nutritional support for the overall well-being of the patient as a whole. Illness is seen as an imbalance in the energy sphere of our emotional, rational, spiritual, physical and social selves. Here it is important to understand the difference between the word disease and illness. The disease, we all understand what it is, but illness are the symptoms created by the disease or without a disease in the body. Healing is concerned with the individual balancing of these energies. What is holism? It is interrelationship of the bio, psycho, social, spiritual dimensions of the person. The whole is greater than the sum of the parts. The individual is a unitary whole in mutual process with the environment. Holistic care model involves assessment, diagnosis, pattern, problem and need, expected outcomes, therapeutic care plan, implementation, evaluation, unit of care that involves the patient and family, settings within the hospital, community care facility, home as well as hospice. Palliative care is a term derived from Latin palliare, to cloak. It is multidisciplinary approach and specialized medical care for people with serious illnesses. The goal of the therapy is to improve the quality of life. It is focused on providing patients with relief from the symptoms, pain, physical stress and mental stress of serious illness. WHO statement describes palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with the life-threatening illnesses through the prevention and relief of sufferings by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychological and spiritual. Which all issues are addressed in palliative care? So, a broad range of issues integrating an individual's specific needs are addressed into care. The physical and emotional effects of the cancer and its treatment may be different from person to person, and as such we have physical, psychological, social, spiritual as well as the intellectual spheres which need to be addressed. The holistic palliative care is provided by a team comprising of a physician, the palliative physician and the specialist physician, palliative nurse, mental health counselor, social worker, volunteer, a spiritual person, maybe chaplain, Maulvi, Pandas, etc. NGOs which provide financial support, help rehabilitation, dresser, financial person, legal person, if available in the team is definitely a much better combination. Physical symptoms may be pain, fatigue, loss of appetite, nausea, vomiting, shortness of breath, insomnia and so on, pain, dyspnea, constipation, diarrhea, ascites, etc. They can be relieved with medicines or by using other methods such as nutrition therapies, physical therapy, deep breathing techniques, relaxation techniques, etc. Psychological and emotional coping involves addressing the anxiety, fear, depression, hopelessness, stress and anticipatory grief, ineffective coping strategies, and there may be suicidal ideation. This all can be addressed through palliative care. The experts may provide counseling, recommend support groups, hold family meetings, make referrals to mental health professionals if and when required. The spiritual aspects of care, they involve understanding and respecting the patient's faith and belief, patient's idea after death, and often asked question. It helps to know the rituals and practices of other faith. Using spiritual means to help the patient cope and accept their illness is a potent force. Every individual has some spiritual belief within them. An expert in palliative care can help people explore their beliefs and values so that they can find a sense of peace or reach a point of acceptance that is appropriate for their situation. What are the social aspects of care? They involve the health of the spouse, the family, especially the children, to help them understand the situation and cope, domestic problem and financial and other feuds. If the patient is bread earner, make effort to rehabilitate the family, and legal advice such as making a will. Cultural background influences how patients make the patient and palliative care decisions. Some cultures place a substantial value on the community, while others encourage individual independence. Some let the family to take the decision and others help patient to make their own decision. The key components, they are recognizing physical symptoms such as pain, nausea, fatigue, breathing or swallowing difficulties, constipation as well as hopelessness. Identifying the patient's goal and development of a palliative care plan, especially for the patient. Understanding that many patients and their families struggle to make decisions. Assisting with the advanced care directives to help people formulate and communicate their preferences regarding care during future incapacity. The models of palliative or holistic care, they are hospice care, hospital care, community settings, and it can be within home care settings also. Hospice care is a well established program to provide patients with a prognosis of 6 months or less, as delineated within the medical hospice benefit. Hospital settings are maybe in the form of OPD or IPD. They occur in ambulatory care settings to provide continuity of care for patients with serious or life threatening illnesses. Community palliative care programs occur in communities as consultative teams who collaborate with hospices or home health agencies to support seriously ill patients who have not yet accessed hospice. Home care services involved home based specialist palliative care services are developed to meet the needs of the patient in advanced stages at home with physical symptoms and distress and ease of death. Take home message: treat the person as a whole, not as an organ or disease, in his or her favorable environment, which most of the time is the home itself, with utmost respect and dignity. It's depend upon our attitude as well as commitment. The whole idea behind the holistic care is to improve the quality of life of the patient, so that the patient not only dies with dignity, but lives a life full of happiness till the last moment of life. It should be cost effective and sustainable, not increasing the cost of death. It addresses issues of equity, justice and other ethical issues. Thank you.